Hi everyone, welcome back to Renourish with Manisha. I am your own clinical dietitian and sports nutritionist Manisha Mehta, and as you know, we have this ongoing series all about diabetes. In the part 1, we have discussed what diabetes is and what are its symptoms. In the second part, we have discussed how diabetes happens. In the third part, we discussed what diabetic people can eat, and today, in the fourth part, we are going to discuss something very specific: diabetes during pregnancy. So if you feel that this video is for you or someone around you, then keep on watching and share it with them. In a recent study, it was found that anywhere between 3 to 17% of the pregnant females have diabetes during their pregnancy. In fact, Indian females are found to be 11 times more likely to have diabetes during their pregnancy as compared to Caucasian women. As we know that the only way for our body to produce energy is by breaking down glucose. Now, the same thing happens with the baby inside the mother also. That baby requires glucose for its cell growth, cell maintenance and development. So, the placenta, which is the tube which connects the mother and the baby, produces certain hormones which do not let insulin do its job of utilizing glucose for only the mother. It actually wants a lot of glucose for the baby also, and that is why insulin sensitivity reduces during the third trimester. If it goes beyond a certain level, then gestational diabetes can happen because there will be a lot of glucose which will be roaming around free in the mother's blood. So next time you remember your mother saying, मेरी जान को आफत करके रखी हुई है, she's actually right. The symptoms of gestational diabetes are just like the normal diabetes. So there will be multiple urination, there will be a lot of thirst, there will be a lot of hunger, and there will be a lot of nausea for any female who is pregnant and is having gestational diabetes. Also, females with history of PCOD are more likely to develop gestational diabetes during their pregnancy because PCOD also leads to insulin resistance. And as a resultant of gestational diabetes, the baby can be overweight at birth, and there can be multiple other complications also which can happen if the blood sugar is not controlled. And on top of everything, the stress actually adds to all the complications and to all the symptoms also. That is the reason why it is said that the mother needs to be happy, needs to be stress-free during her pregnancy. Also, if mother is already overweight before she conceives, then also there will be higher chances that she develops diabetes during the pregnancy, and it can even continue after the pregnancy is over. And that is the reason why your doctor tells you to be at the ideal body weight when you are planning to conceive the baby. If you are someone who is planning to lose weight, then you can watch this video. I have given all the details of what exactly you can do to lose that extra weight. And if you are someone who is facing gestational diabetes right now, then the first thing that you need to take care of is that you need to free yourself of guilt, because this is not your fault. Second, always listen to the doctors for the kind of medications that are given to you. Take them on time, and always make sure that you are hiring an expert for the diet management. Third, gaining weight is a part of a healthy pregnancy, and the ideal weight gain during the pregnancy should be anywhere between 11 to 16 kilos. If you think that you are in your second trimester and you've already gained that weight, maybe you need to talk to your doctor about that excess weight which you are piling on. To ensure that that doesn't happen, the first thing, please do not eat for 2 people. You are a grown person, you are an adult, and the person who is inside you is not an adult. So you do not need to eat for 2 people. As per WHO, the ideal consumption of calories for a pregnant female can range anywhere between 350 to 500 calories over and above an adult female's requirement. That means if you are pregnant, then your ideal calorie consumption should vary anywhere between 2100 to 2400. However, if you are having too much ghee, if you are having too much of fried food, and if you are having too much of sweet, then of course that calorie consumption will go way higher than that, and that will lead to a weight gain which is much more than the ideal, and that way you are actually increasing your risk of gestational diabetes. About the food, it's not only the fat and carbs which are going to give you the ideal diet. you also need to include a good amount of protein and a great amount of fiber in your meals. In fact, there is a study which has shown that with every addition of 10 grams of fiber in your meals, you actually reduce the risk of gestational diabetes by 26%. So, have those whole grains, have those fruits, and have those vegetables. And my next tip to prevent the gestational diabetes, or if you have it, then control it, is that you exercise. You take out some time to do some sort of physical activity depending on what your doctor is suggesting you, and that will help you control your blood sugar levels, that will help you maintain your flexibility, and that will also keep your muscles active. In fact, I have seen so many special classes only for pregnant females, but there are certain females who have never done any exercise in their life and they go for these classes during their pregnancy. It's not exactly the right way to do it, because exercise should be started even before you conceive the baby, so that your body is already strong enough to handle these changes. If you find this video useful, then please let me know in the comments below, because it means the world to me when you give your feedback. And if you feel that this can be useful for anybody around you, then please feel free to share it with them. And on that note, Manisha Mehta signing off. I'll see you next week in a live session which will be all about myths and facts of diabetes. I'll see you next week. Till then, be a fit foodie and always remember, I love you unconditionally. Bye.